If you have questions, please hold them till the end of the presentation, and I'll try to answer as best as I can. I always like to open with a word of scripture. My scripture is taken from Psalms 139, verse 14, and it says, "I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well." And same thing with blood work. Through our little drop of blood, we can see just how wonderfully and fearfully we are made. And through this drop of blood, we can also get analysis of how healthy we are or how sick we are. And one second. But first, it starts with a drop of blood, right? That's probably the most painful part of the situation. Who likes taking blood work or getting blood drawn? Yeah, it's okay. But probably this is the most, they say it's like a mosquito bite, but no, it's not. It's really not a mosquito bite. It's a big mosquito. But anyway, before you get your blood drawn, they might ask you to fast or do certain things before getting your blood drawn. Once you do this, basically they'll ask you to also drink a lot of water or exercise to get your blood flow, so they can get your drops of blood. And then you get these tubes. These tubes are what they use to basically analyze your blood and what's going on, get the values they need to dictate or to find out what's going on with your health. And depending on the test order, you might have to take at least 10 mLs. They'll take at least 10 mLs of your blood. And then it goes to the lab. In the lab, they'll run it through machines. They look under microscopes. And you can either get a complete blood count, a basic metabolic panel, or a complete metabolic panel. And these are different types of blood analysis based on what your needs are. And these you can order, from LabCorp, excuse me, from LabCorp, from Quest, and all the other diagnostic labs. And additional tests, you've got iron panel, lipid panels, different hormone panels, so forth and so on. You can order these things based on your lab test. But why get blood work? Ideally, you want to evaluate how well organs are working, your kidneys, your liver function, so forth and so on. Diagnose diseases and conditions. Find out whether you have risk factors for heart disease. Check whether medications are working or if they're affecting your health. Assess how well your blood is clotting. So there's different reasons why you may want to get your blood work. But there are some limitations to blood work or blood lab analysis. And you should know that they cannot diagnose disease. So even though your values are off, it doesn't mean that you have a certain disease. Because there's a lot of variability. The blood work only captures 80% of the population. So maybe you might be out of that range. So the 20%, you may be out of that range, and you may have unideal values based on these values. So there's statistical variability, there's biological variability. You may be born with something like a high cholesterol value that's out of the range. And individual variability as well. And note also there are possible errors. Depending on the lab, there's at least 5% errors. You've got to have there's a chance of 5% errors that you can get from lab work. And the percentage of errors that we've seen each year, 7 to 10 million errors per year in lab work. So if something's off, don't don't be anxious. Just try to find out if there is an error or a variability. So we're going to go through complete blood work or blood count first. Again, there's CBC, a complete blood count, a CMP, a metabolic panel, and we'll go through all these different analyses. So first is complete blood count, and if you're following me, this is the second to last page, and we'll discuss the white blood cells. So our white blood cells are our army, and we have different types of white blood cells that fight different types of things. Think about the army. You have the military, the Navy, the Coast Guards. You have all these different types of, infantry. And the same thing with our bodies. We are fearfully and wonderfully made, and we have a Navy, we have an army, we have a military, we have some Navy SEALs in our bodies. And these represents our defense. So what are different types of white blood cells, or our army? And again, this is just what we know. This is just what we know from our understanding of the human body at this point. So the normal count of white blood cells, 3.5 to 10.5. That's the normal. If you're ever above this, that means you have an infection. If you're below this, sometimes it could mean that you have a cancer that's killing off your white blood cells. So the first, I call these the army. They're neutrophils. Neutrophils are the first on the spot if you have a bacterial infection. And normal count is 40 to 60%. Absolute count is 1.5 to 8 times 10 to the 3rd. And again, these are our army that fights the bacterial infections. And then lymphocytes. Lymphocytes, normal is 20% to 40%. And the absolute count is 0.8 to 5.10 to the 3rd. And these are cells that fight viral infections, but also they help out with cancers as well. And monocytes. Monocytes are like the do-it-all type of cells. They are on the site when there's a bacterial infection, a viral infection, but also cancers. They help to fight cancers as well. Normal, you want it 7% or less, and your absolute count from 0.1 to 0.7 times 10 to the 3rd. Eosinophils. Eosinophils are usually cells that are elevated when you have an allergen. So if you have asthma or any other allergen, these cells are elevated in your body. Normal percentages are 2% or less, and the absolute count is 0 to 0.4 times 10 to the 3rd. And basophils, they help out with allergens as well. You don't want a lot of these cells in your body. They can cause a lot of damage with the things they release. Those little blue things inside of them, they release those things, and it causes a lot of damage to your cells and other tissues in your body. And they respond to allergens, but also parasites as well. Anything that invades your body that moves, these things are helpful for that. And now we're going to go to red blood cells. Again, this is on the second page, if you're following me with your lab work. Red blood cells have different functions, but the most important function is that they carry around oxygen. And every cell, even the cells in your pinky toe, they need oxygen. So these cells are very important in giving you the oxygen that you need. And red blood cells, the normal range from 3.77 to 5.28 times 10 to the 3rd. And one important component of red blood cells is hemoglobin. So in the center of the red blood cell is a protein called hemoglobin. It's actually two proteins together, heme and globin, and they bind together to basically hold on to iron, and then iron holds on to oxygen. And normal For men, it's 13.5 to 17.5. For women, it's 12.5 to 16.5. But again, there may be a variability in this, so don't be alarmed if you're ever out of the range. Hematocrit is a measure of how much hemoglobin your body has. And basically, it's a depiction of how much your body is making hemoglobin. So normal is 34% to 47%. And MCV is mean corpuscular volume. So how much of the volume of your red blood cell contains the hemoglobin. And normal is 80 to 100. Or I'm sorry, what's the size of your red blood cells? And they have a regular cell. A normal red blood cell has a normal size that it likes to be. If it's too big, it cannot carry the oxygen. If it's too small, it cannot carry the oxygen. So it likes to be just right, the Goldilocks zone, so to speak. So normal is 80 to 100. If you're ever over 100, it could mean that you have a vitamin B12 deficiency, or a folate deficiency, or B6 deficiency. If you're ever below, that means it could mean that you have an iron deficiency. Yeah, I mentioned iron, but essentially the cells like to be a certain volume, a certain size. And then we have the mean corpuscular hemoglobin. A mean corpuscular hemoglobin is a measure of the hemoglobin that's made in, or that's found in the red blood cell. And this value is normal from 26 to 37. And again, you may be, there may be some variability with this. And then you have the mean corpuscular hemoglobin concentration. This is the average weight of hemoglobin based on the volume of red blood cell. And for instance, if you have sickle cell anemia, for instance, you're going to have more volume or less volume? Less, because the cell is smaller. Actually, higher, because the cell, you have less of the cell you have less of the cell, so you have more of the hemoglobin. You're getting more depiction of the hemoglobin than you are the cell, the entire cell. So normal is 31 to 36. And then you have the red cell distribution. Normal is from 12 to 15%. And the red cell distribution is what a lot of doctors use to depict to tell you if you have an iron deficiency. If your red cell distribution is over 16 or over 15, then it could mean that you have an iron deficiency. There are diseases that you can have that can be out of the range where it's lower, but this is rarely found. But essentially, red cell distribution width tells you what we look at it as if you're iron deficient or not. If it's ever over 15%, you're iron deficient. And platelets are like plugs or Band-Aids. Whenever you get a cut, they're the first cells to the area. And whenever they die, they become scabs. So those scabs basically are platelets. And normal is 150 to 380 times 10 to the third. And if you're ever over this amount, you're more prone to clots. So imagine a lot of platelets running through your blood, your vein. You're more prone to clots. If you're ever under, you're prone to bleeding out to death. There was a doctor actually that after he got the COVID vaccine, 10 days later, his platelet counts dropped. And a few days later, he died. So the platelets are very important, just like any other cell. Now the basic metabolic panel. And this is where we go into like our organ health. For instance, the kidney. Kidney function is depicted under the basic metabolic panel. And the kidneys are very important. You have two kidneys, and they excrete waste, but also they are like perfect mathematicians. They'll tell you, okay, your body needs X amount of sodium, X amount of magnesium, X amount of all the essential electrolytes that your body needs. And then we have the GFR. GFR, this should be on the first page, by the way. The GFR is, it stands for glomerular filtrate rate, and it's the rate at which your kidney filters your blood. Every bit of your blood goes to your kidney and it filters out the waste products or keeps in what it's supposed to keep in. Like glucose is not supposed to leave your blood. So the kidney is the one that says, okay, we're going to keep glucose in, we're going to keep proteins in, we're going to get rid of waste like urea and all these things that are wastes. Normal is over 90 mLs per minute. On your lab report, it may say over 59 is normal or good, but ideally you want it over 90, 90 or above. And what keeps this 90 or above is hydration. Your kidneys love water. And you need to basically keep this number over 90. If you consider people who have kidney disease or chronic kidney disease, whenever their GFR is under 90, they have stage 1 kidney disease. Whenever their kidney function is under 60 to 90, they have stage 2 kidney disease. If you're 30 to 59, then you have stage 3A. 45 to 60, that's stage 3. I'm sorry, 30 to 59, that's stage 3. And stage 4 is 15 to 29. Under stage 5, that's when they start considering you for dialysis. So it's best to keep your GFR above 90. Blood urea nitrogen, normal ranges from 7 to 24. And urea nitrogen, blood urea nitrogen, or BUN, is a waste product. And this waste product is created through normal processes in our bodies, and the liver basically makes this waste and sends it to the kidney, and the kidney gets rid of it. So whenever it's high, that means your kidney is not filtering out this waste product. And if it's ever over 25 or 24, basically this is your kidney not functioning well. And for many people who have chronic kidney disease, this number is high. And there's not, if a number is low, don't worry about it. That just means that your kidney is operating at a good rate to get rid of your urea nitrogen, or you're not making as much waste product. Creatinine is another waste product. Normal is from 0.6 milligrams per deciliters to 1.2 milligrams per deciliters. And creatinine, you ever heard of creatine? So creatine is is what the muscle uses for energy. Athletes use it sometimes for, synthetic creatine for energy. And the muscle uses it and then creates a waste product called creatinine. And then the muscle sends this creatinine to your kidneys to get rid of it. And whenever it starts to increase in your blood, again, your GFR is a reflection of that. GFR is lower than it needs to be to get rid of the creatinine or the urea or the waste products. And these two things, the urea and the creatinine, are the things that they measure for people who have chronic kidney diseases. If they continue to increase, the more they need to pull off when you go to dialysis, basically. More waste products they need to pull off. And uric acid. Uric acid is another. Have you all ever heard of gout? Yes. So this is the culprit of gout. Whenever you have a high uric acid count, it precipitates in areas like your big toe or your knee or all your joints, basically. It's very painful. Never had it, but I've heard it's painful. Normal range is under 6. Whenever you're 8 and above, you're more likely to have a precipitation leading to gout. And what increases uric acid? Dairy products, red meat. Certain vegetables can do it as well. But mostly you see people who have a high animal product diet, they have a high uric acid count. Also fish, like tuna, mussels, all these things. Seafood is very high. Alcohol as well. A lot of alcoholics are prone to gout attacks. Yes, acid as well. Electrolytes. Electrolytes are very important. They're essentially important for how your organs function. For instance, if you have too high of a sodium, you can have a heart attack, or you can have a stroke, or fainting spells. If you have too low sodium, you can have the same thing. So your body likes to balance your electrolytes. Potassium, for instance, for lethal injections, they will inject a high dose of potassium and it slows your heart. And that's how you die. So sodium is very important. You've got to keep it within the range. The normal range is 134 to 144. 140 is perfect, but again, so some variability from 134 to 144 is good. And sodium helps to maintain blood pressure, and it's necessary for homeostasis, like I said, of your organs. Chloride is also important. Think of chloride as married to sodium. Wherever sodium goes, chloride goes. Normal is 95 to 103 milliequivalents per liters. And this is helpful as well for a lot of things in the body. Potassium is also important. If you don't have potassium or low potassium in your body, you feel weak. And like I said, it can slow your heart rate as well. But the opposite is also true. Someone with a kidney disorder, if their potassium is very high, the nephrologist would like to take off the potassium or take out the potassium from your blood. It's actually an emergency. If you're ever over 7, it's actually an emergency to get this off your blood, out of your blood. And they'll tell you not to eat certain things, like don't eat bananas or don't eat certain things, because these things will increase your potassium or phosphorus or different electrolytes. But normal is 3.5 to 4.5 milliequivalent per liters. And then calcium. Calcium is very important as well, not just for bone strength, but for other reasons. For your nerves to fire, you need calcium in your blood. For you to think, you need calcium. For you to sleep, you need calcium. Melatonin, for making melatonin, you need calcium to make melatonin. So calcium is very important. So normal is 8.4 to 10.5. And again, if you're ever over this amount, it can cause problems, even sleep problems or nerve problems. Your nerves can fire continuously if you have a lot of calcium. Magnesium is also important. And more so than not, we're magnesium deficient. I've worked in the hospital, and the only time that we measure magnesium is when you're in the ICU. And majority of people in the ICU are deficient in magnesium. And magnesium is like, it's a helper electrolyte. If magnesium is low, then your sodium might be low and your potassium might be low. So sometimes when the doctor says, oh, your sodium is low, why is your sodium low? They might give you magnesium to help you with that. But magnesium is the 4th most abundant electrolyte in the body, and it helps with over 400 different processes in the body. So magnesium is very important. You can get it from nuts and seeds and things like that. But our diets are practically devoid of things that will give us a lot of magnesium. The normal magnesium levels should be 1.7 to 2.2 milligrams per deciliters. Magnesium is not here. Unfortunately, we don't measure it. Blood glucose is also a part of the basic metabolic panel. And blood glucose is essentially your body needs energy. And blood glucose is a very readily available source of energy. Normal is from 70 to 90 milligrams per deciliters. And abnormal, when you're considering if you have diabetes or not, abnormal is when you're fasting blood glucose, so you fasted for 12 hours, and your fasting blood glucose is over 125 milligrams per deciliters twice. If you test and your blood glucose levels 125 milligrams per deciliter twice, you're considered to have diabetes, with signs and symptoms, of course. And of course, they'll also give you an oral glucose tolerance test, or OGTT. And if you ever have a glucose over 200 milligrams per deciliters, just once, you're considered a diabetic. And of course, that's with signs and symptoms. I'll answer that at the end of the... Yes. Mm-hmm. Keep that in mind. If fast for 2 days, okay. And you had a question, sir?
Anything over 200, one time would be your...
Yeah, so they give you a sugar substance to drink, and like 30 minutes or maybe 45 minutes later, they'll measure your blood glucose. And if it's ever over 200, then you're considered to have diabetes.
5 would be closer to the regular range.
Yes. That means your body's appropriately responding to the sugar that your body's taking in. But if not, then you have glucose, a diabetes problem. And the latest test that they're used mostly is hemoglobin A1C. Now, if I were to spill sugar on my hand, or spill a sugary drink or beverage on my hand, and it dries up, what happens?
You see
Particles. It crystallizes, but it becomes sticky. Yeah. And same thing with in your bloodstream, sugar is sticky. So sugar sticks with everything, and that's how you get a lot of the side effects or symptoms from diabetes. It sticks to nerves, it sticks to your kidneys, it sticks to your heart, it sticks to all the cells, right? And it can affect your nerves, causes neuropathy or whatever, but it also sticks to your cells, like the red blood cells. And the more glucose sticking to your red blood cells, or the hemoglobin on your red blood cells, it can depict just how, if you're diabetic or not. So normal amount of sticking to your cells, the glucose should be sticking to your cells, is 4.8 to 5.6%. But you're considered pre-diabetic if you're over this, 5.7 to 6.4, you're pre-diabetic. That means you have too much glucose sticking to your red blood cells. And you're diabetic if you're over 6.5. And I've seen people with 14 and 15 and 18. And that's when they want to start, over 10, that's when they want to start you on insulin. So regardless of signs and symptoms, if you walk into a doctor's office and your hemoglobin is 10, they want to start you on insulin. They know for sure that you have diabetes. And for instance, if I were to fast tonight, and say I had a hemoglobin of 200 milligrams per deciliters every day, and I fast last night and I tried to fool the doctor and say, oh, you know, I fasted last night, my blood glucose is going to be in the range 70 to 90. You can, but they'll do the A1C, and the A1C will tell them what has been your blood glucose levels for the past 90 days. Your red blood cells, they have a lifespan of 90 days. So the doctor can know for sure that for the past 90 days you haven't been behaving yourself. And they can also correlate your average blood glucose for 30 days based on your A1C levels. So for instance, A1C of 5.4, your average estimated blood glucose level is 97. Or your A1C is 10.2, your average blood glucose level is 183 on a daily basis. That's just the average. And then insulin. They don't typically measure insulin, but we do. This should be on the second page under homocysteine, I believe, or right around there. So insulin basically is like a key, and it opens the door to the cell to take in the glucose. Without insulin, your cells cannot take in the glucose. Now, sometimes we don't make insulin if you have type 1 diabetes, and the glucose stays within the blood, and your cells don't get the energy. But sometimes if you're type 2 diabetic, it's almost like the door locks have been changed. And that's what's called insulin sensitivity. With insulin sensitivity, you're releasing a lot of insulin, but your cells aren't able to receive that key. And the blood glucose keeps going higher and higher. So normal insulin is from 2.6 to 24.9. And whenever you're over 10, that's when you're getting into that insulin sensitivity range. If you're ever under 2.6, it could be a problem with someone having a type 1 diabetic or someone being a type 1 diabetic. So ideal is less than 8, even better if it's 4 to 5. That means you don't need as much insulin to take care of your blood glucose needs. And the normal pancreas secretes about 20 to 50 units of insulin per day, and that's enough to take care of your blood glucose needs. Now a complete metabolic panel, and this goes into more so the liver and the serum proteins. The liver, I think we spoke about this yesterday. It does a whole lot of things. Detoxification, produces cholesterol, which we need, metabolism of different amino acids and things like that. Also stores vitamins and minerals, protein synthesis. It does a lot of things. Without it, you couldn't live, to be honest. And one important thing that it does, it makes proteins. It makes proteins, and proteins are basically important for the body's functioning, just to make different hormones and for homeostasis, among other things. Normal range of protein that the liver makes is 6 to 8.5. Ideally, you want to be at 6.5 to 7.5, but this is the normal range. Increased total protein could be seen like in dehydration. Sorry, you had a question?
No, I'm just trying to find, is that on it?
Yes, that is on the first page. Total protein, right under where it says, right under the electrolytes, you see them. Oh, so if you have a high protein count, it could mean that you're dehydrated, but it could also mean that your body's making more protein than it needs to make. And this could be an indication of certain cancers or tumors, or liver diseases as well.
What if it's too low?
If it's too low, that means you're not getting enough, your liver is not making protein. So it could mean that your liver is deficient in making that. Albumin is one of the most important proteins that your liver makes. And albumin does a lot of things. It carries around calcium, it buffers the blood, meaning making it, not too acidic, not too basic. It buffers the blood, it does a lot. But normal is 3.5 to 5.0 grams per deciliters. And globulin is another one. This is on the first page, by the way. Globulin is another important protein. Ever heard of immunoglobulins? Immunoglobulins are very important for our immune systems. But even the HDL is a globulin. Haptoglobin is a globulin. And haptoglobin, for instance, it helps to take the waste product, hemoglobin, when your cells are destroyed after 3 months, your red blood cells are destroyed after 3 months, it helps to take away the hemoglobin, because if you have free hemoglobin going through your system, it can actually damage your blood system. So the liver does a lot of amazing things. We're fearfully and wonderfully made. And these globulins are actually, there's 3 of them, alpha, beta, and gamma. And whenever we have a high gamma globulin or high globulin ratio, it could mean that you have multiple myeloma or different diseases. And bilirubin, who's ever heard of jaundice? Okay, so jaundice is essentially high bilirubin count, and you'll get yellow skin, yellow eyes, but it can also cause brain damage, permanent brain damage. So much so that when babies are born, if they have jaundice, they're at risk for something called kernicterus. And they'll put them in basically an incubation, UV ray incubation, whatever, just to lower their bilirubin. But normal bilirubin should be around 0 to 1.2 milligrams per deciliters. And whenever it's over 5, or actually over 8, that's when you start noticing your skin being yellow, your eyes being yellow, and you're more so prone to get brain damage from that. Alkaline phosphatase is an enzyme that the liver makes. Your bone also makes it. Your intestines also make it. Doctors, they measure this for many reasons, but one is to figure out do you have a bone problem or do you have a liver problem? If all your liver enzymes are within normal range and your alkaline phosphatase is off, it could mean that you might have bone cancer. So they can use this to show if there is an issue with the liver, the bone, or somewhere else in your body. AST is another enzyme, and normal range is from 0 to 40 international units per liter. And it's elevated in viral infections like hepatitis A, hepatitis B, hepatitis C, so forth and so on, and also fatty liver. Whenever your hepatic cells or your liver cells are damaged, it releases its contents, and it releases things like AST, or enzymes like AST. ALT is another liver enzyme, and normal is from 0 to 32 international units per liter, and it's elevated again in viral infections, fatty liver, muscle damage, so forth and so on. And they can actually tell based on what's more elevated. If ALT is more elevated in AST and AST is more elevated in ALT, what kind of viral infection that you're having. Very precise. And GGT is another enzyme, and this is normally elevated in fatty liver, alcoholics, and gallbladder disease. And this is something that, you cannot fool the doctors. You can say, oh, I haven't been drinking, and they do a test, and your GGT is high. It's like, yeah, you've been drinking. Normal is 0 to 60 international units per liters. But it's also elevated when you have, it can be elevated when you have like a gallbladder disease as well. This enzyme lines the, it's like a little line that leads to the, or a little tube that leads to the gallbladder. So all these cells are lined, or the cells that line it they have a high count of GGT. So if you ever have like a gallstone, this can be high as well. Iron panel. And iron is very important. These are like additional tests that we will talk about. Iron you'll find on the first page of your lab core report. And iron is so important that it needs 2 proteins to carry it and to store it. So consider yourself as an iron molecule or mineral. And you come to church, you come to the body. You need an usher to take you to where you need to go. So iron is needed most needed where you make your red blood cells. So you have ushers that take you to the bone marrow and say this is where you should be to help to make the red blood cells. So iron comes in, I don't know where to go. There's a protein that takes the iron where it needs to go, the red blood cells, or the bone marrow to make the red blood cells. And then you have another protein that stores the iron. Iron is very important. So consider the storage protein, which is called ferritin, like an overflow room. Until the usher comes back, there's a room to store the iron. And if you don't store iron, the bank, basically, you need a bank to store iron. If you don't store iron, then your body is deficit of iron when you need it. And as I said, iron is very important. If you've ever been iron deficient, you know you have symptoms like headaches, and you can even have heart attacks from iron deficiency. Normal is from 27 to 139. And iron, again, is very if you're ever in the 100 ranges, that's 80 to 100, that's considered ideal or good. Now, this is the taxi or the usher. UIBC is a protein that the liver makes that carries around or ushers around the iron to where it needs to go. And normal is 250 to 350 UG per deciliters. And like you see, it basically carries the iron wherever it needs to go. Iron saturation, or a measure of ferritin, is the measure of how much our blood or our body is storing ferritin or iron. So normal is 15 to 55%. And whenever it's low, that means our body's borrowing a lot. It's like you go into the bank, you're borrowing a lot of iron, which means that you need to increase your iron intake. And the vitamins and minerals. First up is vitamin B12. Normal is from 200 to 900 picograms per ml. And vitamin B12, all the B vitamins are very important for a lot of functions in our bodies. Even the way we sleep, our nerves health, heart health, very important. We need vitamin B12, but also our red blood cells. Like I said, if you're ever low or deficient in B12 or folate or even B6, you can have a red blood cell disorder. And then B9, this should be on the first page of your lab report. Folate is B9, and normal is over 3 nanograms per deciliters. And folate is very important, especially for childbearing women. You can have neural tube defects or brain defects if you're ever low. The child can have neural tube defects or brain defects if they're not, the mom is not adequate, doesn't get adequate B9 or folate. And vitamin D, you should see this on either the first or the second page. Vitamin D is a very important vitamin. It's actually a hormone, but we've dubbed it a vitamin. And normal range is from 300 to 100. Ideal range, however, is from 50 to 70. 50 to 70, not 60, 50 to 70. That's where you want it. And the best way to get vitamin D is sunshine. The sunshine hits your skin, turns the cholesterol into vitamin D. So you can kill 2 birds with 1 stone. You can basically lower your cholesterol while getting vitamin D levels, adequate vitamin D levels. But you can also supplement. You can supplement with D2, ergocalciferol is vitamin D2. And these are most likely plant-based sources, or vitamin D3, calcitriol. These are most likely meat-based or fish-based, like salmon is very high in D3. But you can also get D3 from plants like dandelion or different things, different herbs you can get it from. But so you don't necessarily have to get it from meat sources. You can get it from the sun or from different herbs. One thing that you can get it from also is from, was it lanolin? The sheep wool protein or whatever. You can get it from that as well. So D3 is more bioavailable, which means your body absorbs it better than D2. So whereas D2, you need to take 50 international units. You can just take 10,000 international units of the D3 and get the same effect. Cholesterol and fats. Total cholesterol, our livers make cholesterol. And the only way, anything that's living and has an eye, mouth, and a nose and an ear, and has a mom, those are the only creatures that make cholesterol. So a horse, a possum, a chicken, everything that's living, a human, we make cholesterol for our needs. A plant doesn't make cholesterol. Herbs, they don't make cholesterol. So the only way you have high cholesterol is if you're partaking of things that have an eye, an ears, a nose, and a mom. So essentially, we should try to, in order for us to lower our cholesterol, we have to really try to moderate or even give up our meat and dairy products. But also fats. Whenever you eat a lot of fats, your body has to transport that fat, and it transports it by the cholesterol. So your liver will make more cholesterol to transport the fat. So things like avocados or nuts. Nuts are very good in protein, but they have 3 times more fat than they do protein. Or free oils like olive oil and coconut oil and all these oils, they're additional fats that your body has to make cholesterol to carry it through your body. So you can be a vegan, vegetarian, and still have high cholesterol because you're eating a lot of nuts or avocados or anything that has fat. So be careful, even if you're a vegan, vegetarian. Normal is from 100 to 199, but ideally we like it to be 100 plus your age. So if you're 55 years old, 155 or lower should be the ideal amount of cholesterol you need. And high density lipoprotein is the quote-unquote good cholesterol. It's a protein that carries around cholesterol basically, but it's a depiction of good cholesterol. Normal is less than 39 milligrams per deciliters. Ideal is over 60 milligrams per deciliters. Typically higher than 60, 65, they don't see an issue with it. But what is seen is if you lower your total cholesterol, your HDL even decreases as well. LDL, we've all heard of LDL. LDL is the bad cholesterol, or a depiction of too much cholesterol in your body. Normal is from 0 to 99. Ideal, 70 or lower. This is what your LDL should be. And there's a lot of rap or a bad rap on LDL causing strokes and heart attacks and other things. So it's good to have your LDL 70 or lower. And then triglycerides. Triglycerides is a storage form of fats. Normal is from 0 to 149 milligrams per deciliters. Ideal should be your age in milligrams per deciliter or less. And triglycerides, whenever you have a high glucose or sugar intake, it gets stored as fat. And your triglycerides can be a marker of just how much glucose you're taking in and being stored as fat. So if you eat a lot of pastries, for instance, this number can be high. Hormones and enzymes. Our bodies basically run on hormones. Like for instance, we talked about cortisol yesterday. Cortisol is a hormone, and cortisol is like the day general. And we talked about melatonin. Melatonin is like the night general. So whenever we need to rest, melatonin is released. Whenever we need to have high blood pressure during the daytime, we need cortisol to release. So our body runs on enzymes, and there's a lot of hormones. Not just cortisol and melatonin, there's many other hormones and enzymes in our bodies. One hormone that is measured, this should be on the second page is thyroid stimulating hormone. And thyroid stimulating hormone does exactly what it says. We all have a thyroid in our necks. It's a butterfly-shaped organ in our necks. And it releases thyroid hormones, T3 and T4. And every cell in your body has thyroid hormone receptors. So thyroid stimulating hormone is a hormone in itself that stimulates the thyroid to make thyroid hormones. And this hormone, TSH, it comes from a pituitary gland, the posterior pituitary, and it releases into the bloodstream, goes to the thyroid and says, wake up, we need to make more thyroid hormones. So whenever we don't have enough, say for instance our thyroid gland is sluggish. If it's sluggish, that means it's not making enough thyroid hormones. That means the pituitary gland is going to release more thyroid stimulating hormone to stimulate the thyroid gland to wake up. You have to wake up and make more thyroid hormones because every cell depends upon you making thyroid hormones. So if your thyroid gland is sluggish, you're going to have a high thyroid stimulating hormone count in your blood. If you're ever, if it's higher, guess what? You're going to have a lower TSH, thyroid stimulating hormone, because the pituitary gland is saying, listen, the thyroid gland is making more than it needs to make, so I'm not going to stimulate it anymore to make even more. So if you're high, if your hormones, your thyroid gland is making more, you're hyperthyroid. If your thyroid gland is making less, you're hypothyroid. And vice versa. So I was talking in regards to the thyroid gland. But if your TSH is high, that means you have a hypothyroid. If your TSH is low, that means you're hyperthyroid. Is that clear? Good. So if your TSH is less, that means your thyroid gland is making more thyroid hormones, so I don't need to stimulate it anymore. So that means you're hyperthyroid. Your thyroid is hyper-functioning. If it's high, that means your thyroid is hypo-functioning. It's not functioning adequately to produce the thyroid hormones. So low thyroid stimulating hormone means you're hyperthyroid. High TSH means you're hyperthyroid. I'm sorry. Hypo, yeah. Tongue twist. Prostate specific antigen. We don't measure this, but it's good to, for men at least, it's good to note this. Normal is less than 4 nanograms per ml. And whenever you're higher than this, higher than 4, 1 to 4 is ideal. Whenever you're higher than this number, you can have what is called BPH, or benign prostatic hyperplasia. From 4 to 10, that's what you're considered to have. If it's ever over 10, you may have prostate cancer. Other notable tests are homocysteine. Homocysteine is an amino acid, and homocysteine is like, think about it as an anchor, and it's basically traveling through your blood vessels, and it's scraping the bottom of your blood vessels. So the more homocysteine you have, the more damage you have to your blood vessels. And once you basically have that damage, guess what gets stored into those little damaged areas? The cholesterol, yeah. And then it keeps building and building and building until you have less blood flow to your heart, and then you can have a heart attack, or less blood flow to your brain, and you can have a stroke. So homocysteine, if it's ever too high, it's an indication that you have high inflammation that can cause damage to your heart or brain, or basically blood vessels. And homocysteine, to get it in normal ranges, it depends upon your vitamin B12 and vitamin B9 and vitamin B6. So if you're ever low in these vitamins, your homocysteine levels are going to be high. But also B6, B9, and B12. But also if you're ever eating meat or drinking caffeine or drinking a lot of sugary beverages and these things, it can also increase your homocysteine levels.
B complex, can't we find all those three vitamins?
Yes, B complex has all these, the essential B vitamins that you need. So you can take a B complex to lower your homocysteine levels, but also ensure that you're not eating things that will increase your homocysteine, eating or drinking things that will increase your homocysteine levels. Ideal is under 10. It's even best if you're under 8. C-reactive protein is a protein another protein that your liver makes, and basically it's in response to an inflammation. For instance, inflammation or infection. For instance, if you ever were to have the coronavirus and you measure your C-reactive protein, it will be very high, like in the 90s to 100s, but normal is under 1. So you can have a homocysteine level that's 100 times greater if you had an infection or inflammation. But also, if you have rheumatoid arthritis or any autoimmune disorders, CRP or C-reactive protein can be elevated as well. So normal again is under 1, and if you have an active inflammation, active infection, active inflammation, it can be over 10. Some people with cancers have CRPs over 100s, and that's 100 times more than what your body needs to have. And it's a marker, a non-specific marker of inflammation. So doctors can say, okay, your CRP is high, but I don't know where it's coming from. Let's do more tests to see if you have an infection, let's see if you have cancer, let's see if you have whatever, rheumatoid arthritis or autoimmune disorders. So this cannot tell you that you have a disease again, but it's a marker that says you may have something going on. Sedimentation rate is another non-specific value that tells you if you have inflammation. So red blood cells like to be separate. They would like to travel separately throughout the blood. And whenever you have inflammation, they stick together and they fall to they sediment to the bottom of your blood vessels. And say you have rheumatoid arthritis or another inflammatory disorder, even cancers, your red blood cells, they stick together. So the sedimentation rate is a measure of inflammation and how much your red blood cells are sticking together. Normal is from 0 to 30 millimeters per hour. For men, 0 to 22 is ideal. For women, 0 to 30 is ideal. So my closing scripture is taken from Revelation 12, verse 11. It says, "And they overcame him by the blood of the Lamb, and by the word of their testimony, and they loved not their lives unto death." Doing blood work can be painful, but consider the pain that Jesus Christ went through for you. And consider his blood. His blood is pure. Even if your blood is impure, his blood is pure. And you can claim his blood today. So I pray that you were blessed by this, and may we claim this blood that Jesus Christ offers today. Any questions?
What part of the thing is the C-reactive?
Oh, sorry, C-reactive protein is right under the lipids, or second page on the so on normal blood test, if you got a blood test with us, you get C-reactive protein. But on normal blood tests, you don't get these things. Yeah. Yeah, unless you have a specific autoimmune disorder or like a cancer, they won't measure it. Yes, you can. We can use our panel, and we will measure these things. Insulin, C-reactive protein, homocysteine, all these things we think are important. Exactly. You're welcome. We don't, unfortunately not. Or Medicare doesn't take us. Yes. Destruction of red blood cells, for instance. What causes high levels of bilirubin? For instance, destruction of red blood cells.
Is that something that a mother can do once she's pregnant to cause that? When a child is born jaundice, my older son was, and I was also born jaundice. I don't know if that's hereditary or something a mother can do to prevent the child from.
The question is there something a mother can do to prevent a child being born with high bilirubin levels? Yes and no. I mean, think about, childbirth. It's very traumatic, and you're squeezing through a small, channel. So you're going to destroy a lot of red blood cells. And that's what increases the bilirubin count. But it's, don't fear. I mean, our cells, when we're born, are very fragile. So us coming through a narrow passage, it's going to be very fragile. But for bilirubin, even if it's high, all we have to do is use the UVB rays or the sunlight. Put a baby out in the sun. So essentially, you can do things before, but even if you do have issues after a birth, you can easily, have a remedy for it. Sorry. Yes, you have a question? Yes. Mm-hmm.
So then if you take certain medications in pregnancy, something as simple as Gout and any type of medication, and at delivery, it can cause the child to be jaundice because of the chemical anemia that may occur secondary to medication. So because of the fact that you mentioned seeing the travel in your family, it could be a genetic disposition. So you may want to have that enzyme checked, because it can be handed down from mother, so then your child can also have it. So it's something worth checking into, that's what I'm saying.
Yeah, I would say that, so the comment was that you can have certain genetic predisposition to having high bilirubin levels. And yes, they are different diseases, some mild and some very severe. Like Crigler-Najjar, for instance, is a very severe disease where people can have high bilirubin levels, but it's manifested only if you stress. Like for instance, if you stress, your bilirubin levels will be high. So, but those are very rare. I would say Crigler-Najjar, or there's another one that's sticking in my mind. But basically, those are very rare. And bilirubin is most likely elevated when we have things like sickle cell anemia, for instance, as well, because our body is destroying a lot of heme, or red blood cells. So when we destroy the heme, it has to become a waste product, and the waste product is bilirubin. So in these certain diseases, we can have elevated bilirubin, but those are very rare. It's more likely that there is a problem with the destruction of red blood cells at childbirth rather than there is a rare disease occurring. Test for bilirubin. So the question is, do we do any other tests like vitamin K deficiency in regards to bilirubin? Oh no. So vitamin K is like a subgroup of different vitamin K molecules. There's a lot. When you say vitamin K, it's not just one molecule. It's vitamin K this, vitamin K that, vitamin K this. So it's different, like vitamin K2, for instance. That means there's a vitamin K1. There's a vitamin K different number. So basically, we don't measure that, and we don't know. Boris Johnson once said, he's the Prime Minister of the UK. He said that through technological exploits, we can find out the secrets of every living thing. But he says at this point in time, we know only 0.3% of the secrets of all living things. We know the secrets of all living things. And how much do we know? Not 3%, 0.3%. So that's all we know. And our tests basically reflect that. What we know about the human body, our tests reflect that. So basically, we can't measure vitamin K and all these other things because we don't really know just how much they do for our body, and we don't know as much as we should about the body. We know the tip of the iceberg about our bodies.
The men in our families with genetic deficiency, vitamin K, and I knew there was a test specific for that, so I don't know if you offer that.
Most likely, even the labs that measure it, sometimes there are errors. So a lot of these tests, we don't really do them because we haven't found the best possible way to measure vitamin K and magnesium and all these things. We have, these blood tests that we can do, but again, it's not as effective or efficient in measuring these things. 2 more questions.
When you mentioned the brain damage from low bilirubin, that's over a long time, right? Like if a baby's born with low bilirubin and it's corrected quickly, that's not possible.
No, so your question is with high bilirubin, by the way. So with high bilirubin, you're at risk for permanent brain damage. And yes, that's an over amount of accumulated time, that's over amount of time. So if your bilirubin level is like an 8 or 10 or 12 today, and you rectify the problem today, you're not at risk for brain damage. You have a question. One more. The mean corpuscular volume, basically, if it's high, it could mean that you're deficient in B12, B9, or B6. If it's low, it could mean that you're iron deficient or other things. If it's high, it could mean that you have a B12 or B vitamin deficiency. Yes.
High albumin levels.
High albumin levels.
With a relatively good blood panel, other than that, just that was off.
Yeah, so that means that your liver is creating more albumin than it needs to. But also, it could mean that the liver is trying to fatten the blood with albumin, with proteins, because you don't have sufficient fats in your blood.
Could it mean that your body's not metabolizing the fat that you intake?
Say that again?
That maybe your body's not metabolizing the fat properly that you intake?
It could mean that. It could mean also, there's different reasons why your albumin levels will be high, but again, that's more likely like a more specific thing that I would have to see your lab work to see that. Any other questions?
A really high vitamin B12.
Oh, don't worry about that. Your liver stores B12. The question is really high vitamin B12. Is that a concern? And this is the last question. No, it's not a concern. Rarely you'll see vitamin B12 toxicity. Ideally, we should be around 500 to 700, but there's no concern about that.
Especially taking supplements, it makes it higher.
Yes. All right. Thank you so much. All right. One more question, and that's it. Eric has to start soon.
Can you have too much vitamin D3?
Yes, over 256 nanogram per deciliter, you have D toxicity, but it takes time for you to get to that level. Vitamin D, it basically extracts calcium from your gut. It does a lot of other things, but say for instance, if you start having nerve issues or whatever, you can be sure that you're having a vitamin D toxicity. But also bones being brittle, these things are an indication that your vitamin D levels might be high. All right.
Before a blood test, is it wise to go off your vitamins and minerals if you're taking like D or B, bone and stuff? Does it matter?
The question is, before a blood test, is it wise or would it be helpful to go off your supplements and vitamins? No, not necessarily. You basically why do you take the vitamins and the supplements? To see if your levels are high or low. So basically, if you want to maintain those levels, keep taking it, even before your blood test. So that's it. Let's have a word of prayer and just close. Kind and Heavenly Father, thank you so much for teaching us about your grace, your mercy, and your love, but also a reminder that we're fearfully and wonderfully made. I pray, Father, that you will reveal to us the secrets that you have in store for us in helping us to have the health that you want us to have, the physical, the mental, and the spiritual health, Lord. Please reveal to us today through this presentation and through all that we are able to claim even today through the blood of Jesus Christ. Thank you, Lord, for all things. In Jesus' name we pray. Amen.